Who'd have thought I'd be happy to see Frank walking through the door? He's a changed man. I remember the day he first came to see me. He told me how many different appointments he had and a long list of problems. He was clearly depressed. His family was being affected too. I didn't know where to start with him.
It was a nightmare. I didn't know why I was taking all these tablets, and I felt terrible most of the time. Money was such a worry too, but I didn't think I could tell my doctor that.
So I chatted to colleagues over coffee. Liz started talking about collaborative care and support planning she'd heard about at the college. She thought it was worth a go. By that point, I was willing to try anything. So I suggested a practice meeting to plan a way forward. We decided to start with a small group of patients, and Frank was top of my list. We'd already started having MDT meetings within the practice, but we arranged the next one with a specific collaborative care and support planning focus. The toolkit on the college website was a big help. We discussed how to approach this and what we could use, things like risk stratification tools and the frailty index. Tim highlighted the importance of clinical acumen too, and he's absolutely right. Bev volunteered to be the admin lead on the project, and she started ensuring we had the information we needed on the system. This meant sending out invitation letters and care planning prompts to patients, and generally checking we had a system in place that would allow us to manage the process and help the clinicians prepare too.
I didn't feel too good after that first appointment with Dr. Evans, but then I had a call from the practice administrator inviting me and my wife to a meeting about my care, and they sent all these forms. I wasn't sure what to do, so I called her back. She put me in touch with someone from a local charity to help me. Tom was brilliant. Next, I went to see the nurse for blood tests and a checkup.
When I saw Frank again, I had all the information I needed and a clear idea of how we could help him. We set goals and developed an action plan together that included social prescribing for exercise, diet, and smoking cessation. We agreed a review too. Frank's care plan and the action plan went on the system. We were in a much better place to help him. He started on new meds, and I referred him for smoking support, and the support charity was fantastic in advising him on his finances. They referred him to social services, who helped with his housing situation. It made such a difference as he was able to focus on his health, and I felt supported by the team involved in his care. The system sent Frank a text reminder for his review, which often gets forgotten, and we did this successfully over the phone. The plan helped him keep on track, and the review meant he took it seriously.
Getting help with the things that worried me, alongside my health stuff, made a huge difference. I've lost weight and stopped smoking, and I know more about my condition. I'm even more involved in my community.
Frank's a different person now. It was a bit of an effort to get the system going, and Liz had to repeat some steps with her patients, but it's worth it. We all feel it as a practice, so we're extending it to more patients. I definitely recommend it. It's brought back a bit of the joy into our careers.